Welcome everyone. Let's just dive right into this. Today we're doing a deep dive, a masterclass explainer really, on the economics and legal realities of elder care, and we're looking at it all through a really vital lens, the faculty perspective. In this explainer, we're not just going to treat these systems as abstract concepts. No, we're looking at them as dedicated advocates for older adult independence. Whether you're navigating these waters right now for a family member, or maybe you're a student entering the healthcare field, understanding the continuum of care and the safety nets we have in place is absolutely crucial. Our primary mission today is to empower you with the exact knowledge you need to protect and support the independence of the older adults in our communities. Think of this as our syllabus for today. First, we'll cover the goal of independence. Second, community and respite services. Third, transitions and culture change. Fourth, financing the continuum. And finally, protecting vulnerable adults. All right, let's get started.
Section 1. The goal of independence.
As advocates, our absolute North Star is keeping older adults functioning independently, or at least semi-independently, in their own homes for just as long as safely possible. You know, there's this great thought from Carol Burnett. When you have a dream, you've got to grab it and never let go. For so many of the older adults we work with and care for, their biggest, most fervent dream is literally just to stay in their own home. It's an incredibly powerful, aspirational drive, and honestly, as advocates, it's our job to help them grab onto that dream and hold it for as long as possible.
So, the crucial point here is understanding why the home matters so much. Well, it goes way beyond just having a roof over your head. An older adult's home is deeply, deeply associated with their personal identity. It offers this crucial sense of familiarity and predictability, especially in a world where their physical health might be getting, a bit unpredictable. It provides profound feelings of safety and established boundaries. I mean, their home is a living museum of their precious memories and their absolute anchor to neighborhood connections. Removing someone from their home isn't just a physical relocation, it is a massive psychological shift.
But to keep that house functioning as a safe haven, we have to build some practical, real-world scaffolding around it. We're talking about resources like home health care, dependable housekeeping, and lawn care services, including snow removal, right? It might even require home repair services to fix tripping hazards, and obviously, the financial resources to actually pay for the whole shebang. Because independence rarely means doing it entirely alone, it means having the exact right support system built around you.
Moving on to Section 2, Community and Respite Services.
So what happens when families and neighbors just hit their limits? When a private home is no longer a viable, safe option, we need structured support in the community to help our loved ones successfully age in place. And we have to be really careful to distinguish between the residential options here. Independent living is exactly what it sounds like. It requires absolutely zero skilled nursing care. It's more about community and downsizing. Assisted living, on the other hand, bridges a gap. It's for folks who can no longer live completely independently. Maybe they need a hand with meals or medication management, but they absolutely do not need the 24/7 skilled nursing monitoring of a nursing home. Differentiating these levels of autonomy is totally key to placing someone in the right, least restrictive environment.
But hey, let's not forget the invisible backbone of elder care, the family caregiver. This is where respite care comes in. These are services, like adult daycare, that offer temporary relief, education, support groups, and counseling for family caregivers. And I really cannot emphasize this enough. Providing relief to exhausted caregivers is an absolutely essential piece of the long-term aging puzzle. Think about it. If the caregiver burns out, the older adult's independence is instantly compromised. Respite care is definitely not a luxury, it is a vital necessity.
Section 3, Transitions and Culture Change.
Across the continuum of care, patients often have to move between settings, say from home to hospital, from hospital to rehab, or into a nursing home. And I've got to warn you, moving an older adult between settings is considered one of the absolute most stressful events they can experience. Did you know 1 in 5 older patients is readmitted to the hospital within 30 days of discharge? 1 in 5. It highlights a massive revolving door crisis in healthcare. Poorly managed transitions lead to relapses, new infections, and incredibly negative outcomes. As advocates and healthcare professionals, managing these transitions meticulously is where we can make a truly massive difference.
Now, if a transition to a nursing home is necessary, there's actually some incredibly good news on the horizon. For decades, nursing homes operated strictly on a medical model. It was highly clinical, sterile, very hospital-like, and dictated by super rigid routines. But today, there is a massive culture change movement shifting toward the home model. This approach creates warm, nurturing settings. It is resident-directed, meaning it allows individuals to make decisions about their own daily routines and deeply, deeply respects their individuality and preferences.
This culture change really starts by flattening those traditional organizational hierarchies, by empowering the staff to make collaborative decisions and respond directly to the residents' desires. We provide immense emotional benefits for the residents themselves. It literally transforms the environment from a place of simply surviving to a place of actually living.
All right, Section 4, Financing the Continuum.
Providing this level of care brings us face to face with the hard realities of healthcare economics. Long-term care is incredibly expensive, and those costs are only continuing to rise. Balancing the heavy economic weight of elder care against complex legal frameworks requires some really careful navigation. The financial decisions made in late life have massive quality of life implications, so understanding the systems that pay for it is a totally vital advocacy skill.
So let's quickly break down the alphabet soup of Medicare so you can effectively assist in discharge planning and care continuity. Here is your quick cheat sheet. Part A covers acute care or short-term rehab, think hospital stays. Part B is your original fee-for-service outpatient care, like seeing your regular doctor. Part C represents Advantage plans, which kind of act like HMOs or PPOs to replace A and B. And Part D, that's your optional prescription drug coverage plan. Grasping this matrix is step 1 in financial advocacy.
And then, of course, there is Medicaid. Medicaid is funded jointly by both the federal and state governments. While Medicare is based on age, Medicaid acts as this vital safety net, providing care for individuals with low incomes. And crucially for our older adults, Medicaid often covers many of the long-term care services that standard Medicare simply does not touch.
Which brings us to Section 5, Protecting Vulnerable Adults.
Because look, understanding all the economics and the care options means absolutely nothing if our patients aren't safe. We have a profound ethical and legal duty to advocate for and protect older adults from harm. A key tool in this protection is the Durable Power of Attorney, or POA. This is a legal document designating a person who can make health-related decisions for someone when they lose the capacity to do so themselves. And I really want to stress the word durable here. A general power of attorney might just let someone pay bills, but a durable POA or healthcare proxy specifically grants authority for health decisions. As advocates, we must always know who legally holds this proxy for our vulnerable patients.
Unfortunately, vulnerability can lead to exploitation. It's tough to talk about, but we must solemnly review the horrific realities of elder mistreatment. There are 6 main types of elder abuse we have to be constantly vigilant against. There's physical abuse, sexual abuse, emotional abuse, which includes things like name-calling or scaring them, neglect, which is failing to meet basic needs, abandonment, and finally financial exploitation, which is the illegal misuse of an elder's money or property.
Spotting this, it takes a highly trained eye. When assessing for physical abuse, you've got to look closely for physical red flags, things like unexplained dehydration or unusual weight loss. Pay attention to missing daily living aids, like if they suddenly don't have their glasses or hearing aids. Look for unexplained bruises or unattended medical needs. The really tricky part here is that these signs can sometimes mimic the normal changes of aging, and that is exactly why our nursing assessment and clinical judgment must be incredibly sharp.
But we can't just focus on the patient. We have to actively observe the caregivers too. Red flags show up in that dynamic. Is the caregiver the only one talking during your visits? Do they demonstrate visibly frustrated or indifferent behavior? Does the caregiver have a history of substance abuse or violence? Or maybe they are experiencing extreme social isolation and burnout themselves. Guys, these are massive risk factors for elder mistreatment.
So, if you see something, here is your direct call to action. Assess first, conclude later. You don't need to be a detective to step in. You just need to be an advocate. Your immediate job is to assess for the presence of physical danger. If they are in danger, seek help right away. Keep those communication channels wide open. Document exactly what you see and report it through the proper guidelines. We are literally the front line of defense here.
I want to wrap up our explainer today by leaving you with this somewhat provocative final thought. What issues are involved in adapting to transitions and role changes in later life? We've spent this whole time talking about the systems, the money, and the laws. But behind all of that is a human being navigating the profound emotional weight of aging, desperately trying to hold on to their identity and their independence. I want you to really reflect on that as you go forward in your advocacy. Thank you so much for joining me for this explainer, and I'll see you next time.